Hi Pooja.
Hi Prachi, hi. So yes, for everyone who joined in, welcome to the second episode of Decoding Mommy Life with the experts. And today's topic is common breastfeeding issues. We have with us Dr. Prachi Ghera. She's a dentist. She's a certified lactation professional, advanced, and she's also a maternal and child nutritionist, certified nutritionist. So welcome, Prachi. We're so glad to have you
Thank
on
you
our episode.
so much. It's my pleasure.
So please stay tuned till the end. We're going to discuss the most common issues, and Dr. Prachi here is going to tell us a lot about how we can deal with them. So without further ado, let's get started with some of the issues. So Dr. Prachi, I think one of the this topic is very close to my heart as well because as a new mother, like I have a 1.5-year-old son, and as a new mother, I personally struggled a lot during the phase when I had to breastfeed my child. Right, initially the first 2 months they were quite overwhelming, I would say, and I think it is for most of the mothers because while you're prepared to deliver your child, while you're prepared for so many other things, but you're never prepared to breastfeed because you cannot practically experience that before actually going through it. So there's a lot that mothers, I think, they can relate to, and we're going to discuss some of it today. Um, so, you know, let's start from the beginning. The first thing that people experience a lot is pain during breastfeeding. Now,
Absolutely.
during the initial few weeks when they are supposed to meet the demand of feeding the child at least 10 to 12 times, most of the mothers experience pain. So is it something that is normal or is it something that we're not doing correct to, or is it not, are we not latching well? When does the pain subside? Can you throw some light on these?
Yeah, absolutely. So, it's a very nice question, because one very important thing which every mother, should know is that breastfeeding should be a very pleasant experience, okay? It should not be painful at all. And if it is painful, it means there is something which is not going right, and it is the time that you should consult a professional, you know, find out that what is the problem, right? Number two, yes, of course, once you start breastfeeding during those initial few days, you might experience little pain, because as a new mother, as you just said that we don't know how to hold the baby, we don't know, and even the baby is also learning, right? So sometimes there might be a little pain in the starting, okay, for like let us suppose 4 5 days, but then it should go away. If it is sustaining over the period of time and it is very painful, and you're not having good experience, then you should definitely consult. Pooja, a lot of times people might say it is the biggest myth also that, thoda sa pain hai, a little pain is fine, you should keep on breastfeeding. But as mothers, we need to understand that small pain, is going to create some negative feelings in our mind over the period of time, and gradually, we won't enjoy it, and then we might find out, we might find out reasons or ways to just stop it because obviously, we are not feeling comfortable. So yes, very rightly said. In case you are having any pain, while breastfeeding, please consult the professional immediately. I would just like to quickly tell there might be few things. Just get the latch assessed, the positioning assessed, in which you are holding the baby. And the last thing is get, the oral cavity of the baby assessed. These are three important things which you should take care.
Okay. Thank you, Prachi. That was very, very, I think, insightful. A follow-up question to that is, you know, let's say you are having pain issues and you have sore breasts and you have some cuts. What is the next step? Should you stop breastfeeding for a while or should you continue? Should you alternate?
Yeah.
What is the best solution? Should you be applying any medication? What should you be doing?
Absolutely. So, like, if you are having sore nipples, which are painful, injured, okay. So, the very first thing is, you should never think about stopping breastfeeding because that is going to create, more and more problems. But number two, if they are very sore, very painful, and the pain is unbearable, then always it is important to till the time you are not getting the help. Let us suppose you are having pain, but now you cannot go to a professional immediately. the best thing is you should start hand expressing. Okay? And you can hand express the milk and you can give it to your baby with the help of a katori or with the help of a cup. You can give it to your baby. The best thing, the most important thing is that the breast stimulation should not stop. Okay, you can always give time to your nipples to heal. Okay, till the time that professional help is achieved, then you should continue breastfeeding. Okay. Secondly, if it is painful, important is that correct the latch, because if the latch is not proper, that the way in which you are holding the baby and in the way in which the baby is sucking the breast, if that is not proper, then whatever you do, whatever you are trying to put, whatever you do, the problem will continue to happen. So that is very important to resolve. Okay. Number three, there are few things which you can do to just have the symptomatic relief. Like you can try to apply little cotton dipped in ice water over the nipples just before starting the breastfeeding and after the breastfeeding. Okay. And the other thing is that, let us suppose you have sore nipples in right breast. Okay. So try to latch the baby on the left side first till the time the leg down happens, and then you can switch on to the right breast. Okay. And the last thing is definitely consult your doctors and professionals for the application of ointment, which they will advise. Don't use them by your own, because sometimes it can be some kind of infection also. So if you will just buy over-the-counter drugs and you will start applying, it might not heal. Your problem might not get solved. So these are few tips which you should start immediately, and don't stop breastfeeding. Try to get help immediately. If not possible, start hand expressing and pumping.
Right, right. Just, I mean, I think this solves a lot of problem for new mothers. I wish I had got this advice when I was facing issues myself. But yeah, I personally continued and I tried to express by hand, like what you're saying. And it did work for me. So I think it's a good advice all of you can take. Uh, what generally happens is, some mothers start with a bottle because they feel that katori chammach becomes too much of an, it becomes very hectic to feed the child again and again with the katori chammach. So they start bottle while they're not able to breastfeed, and they're alternating between that. So do you think nipple confusion may happen, or any advice to new mothers on whether they can alternate between bottle and breast?
Hmm. So, so if we talk about bottles, it is really important to understand. Very important thing is that while the baby feeds from the breast, the mechanism which, the overall babies follow and the movement of the muscles of the mouth and the tongue is completely different when the baby bottle feeds. Okay. So, and the flow of the milk is also different, the milk which comes out from the breast and the milk which comes out from the bottle. Okay. So, obviously, there are always chances of, for that confusion, we will say nipple preference. Your baby would definitely prefer, if the baby gets into the habit of drinking from the bottle, then in many of the cases, the baby starts preferring, bottle nipple over the breast. So definitely the mothers would find it difficult to get the baby back to breast, and that might lead to, compromise on the milk supply also, because baby will not feed, and the milk supply might get disturbed. So yes, always very important that, in case of sore nipples, if it is a sore nipple, let us suppose, so it is always better you express and use a cup, or, cup to feed the baby, or a katori to feed the baby. Okay. Let us suppose if there is any other issue, the baby is not latching or the milk supply is low, let us suppose, that's why the mother is using the bottle. So in that case also, it is extremely important that, you should use a cup, for giving formula also if it is needed, or you are expressing and giving it to the baby because the baby is not latching, let us suppose, then also please use the cup. Or there are other methods, like which you can consult your professional. One of them, the most important, is supplement nursing system at breast. In a very layman term, it is just a way in which you can give, expressed milk or the formula milk at the breast, if it is needed. So do get in consult with professionals. They are really going to tell you some amazing ways, to follow these things so that there is less of confusions. And the last thing, let us suppose you still have to give, there's a day where you have to give bottle, there's no other choice. Not a problem. I completely respect that. try to follow paced bottle feeding. Okay, that is a way in which you should actually use the bottle. Very important to invest in a good bottle, which has a good flow in the sense which doesn't have a very fast flow, which is just which can mimic the breast. Okay, and try to follow paced bottle feeding. You can read about it, so just make sure that you're feeding the baby in the correct way, so that the baby doesn't get used to drinking a lot at a very faster pace. These are few things which you should keep in your mind.
Thank you, Dr. Prachi. That was very, very useful. You mentioned a word saying milk supply. I think that's the next part of our conversation today. Many mothers feel that they're not able to lactate enough, or am I producing enough milk for my baby? Is my baby still hungry? What should I do? My baby is still crying after feeding. So, what advice would you have in that case? How can we increase the
Absolutely.
production?
This is very, very, very common, and I think each mother faces this. Even you must have faced it, I also. So I think that's why, I ask everyone, it is extremely important, to prepare yourself, because if you know from before, then it is, you don't get influenced by the people around, okay? Second thing is that whenever you deliver the baby, just keep one thing in your mind for the new moms, that, you don't produce the milk at that only time when you deliver the baby. The milk is there inside your breast since you were 12 to 13, 16 weeks pregnant. The milk is there, the colostrum is there. So, as soon as your baby will start sucking, the milk is going to come, okay? And absolutely, the milk which comes, it is in very less quantity, few drops, So that makes mother think, okay, the milk is not coming, it is very less, but we have to understand that it is biologically designed and our baby's requirement is very less during those initial days after birth. So those little drops are sufficient for them. They are power pack food, those are superfoods, so like very nutrient dense, and babies are satisfied. Baby will definitely get satisfied. Gradually, as you will start, the baby will start latching, the baby will start feeding, more often. The milk supply will, will keep on increasing and will settle down over the period of time as per the requirements of your baby. Okay. So don't get confused or don't get influenced, even if your baby is asking for milk every 1 hour. I'm talking about new moms, Let us
Right.
talk about first 15 days, 20 days. Please don't get confused. Just keep on latching the baby, keep on latching the baby. Okay. Yeah, some parameters which can help you, to make sure that whether, the milk supply is good or not, whether the baby is, receiving enough. Is there are few things. Keep a check over the pee count of the baby. That is the urine output. So, but after 6 days, once the baby turns 6 days, after that, the urine output should be more than, like, it should be 6 times or more than 6 times in 24 hours. Okay. And similarly, the poop count, okay, it should be after 6 days, it should be like 3 to 4 times, or at least, 1 times in 24 hours. And the last parameter is the weight, okay, which definitely your pediatrician is going to examine to check, whether the baby is, having a good weight gain or not. So so it's better you get it assessed by a pediatrician instead of just doing that home, because in that case you will face a lot of errors, okay. So generally, your baby will lose, some amount of weight during the first week after the birth, and the baby is going to regain the birth weight once the baby will turn 15 days, 16 days. Okay, so that these are few things which will, tell you that okay, you are on the great path. Okay, in case, let us suppose you still feel, that I am not making, the baby is not getting satisfied. So please get an help from a professional. That it's very important to see whether you are latching well or not, whether, the baby is in the correct position or not, whether there is any oral restriction which is not letting it happen. Okay. And if needed, whether the baby is having jaundice. Okay. And if needed, trust me, if any kind of supplementation is needed, the lactation professional and the pediatrician are really going to advise you, if needed. So just trust your doctors and professionals, just consult them, and don't worry till the time all these things are in these parameters, just keep on feeding. Just make sure that you just have to feed the baby, you have to eat the food, and you have to use the washroom, then you again have to sit and feed the baby. Don't do anything else during the starting months, okay?
Thank you, doctor. So, actually, very rightly said. The entire concept that you explained, I think, is on demand and supply. The more you feed, the more milk you get those signals in your brain to make more, produce more milk, and
Absolutely.
that's how it, right? But even then, let's say some mothers still want to know. Some mothers are interested to know how can I increase my milk production. So, does it really depend on the food? Is there some suggestion you could share? How we can, what kind of
Definitely.
diet should be there to increase the production?
Yeah. So see, there has been no particular evidence which says that you have these things, so milk supply will increase. But definitely, you can add few things in your diet, which has been seen over the period of time that it does make difference. But the dietary food will only make difference when three things are in place. Okay, number one, the baby is latching very often. Okay, like the baby is latching every 2 hours, 3 hours, and the latch is deep. Number two, you are holding the baby in the correct position and the baby is latching well. And the last thing, if in case you are not latching, you are pumping regularly every 2 hours. So the breast stimulation should be there. Then only all the dietary items are going to happen. So to be very, quick, it's really important for mothers to have high protein rich diet. They should keep themselves hydrated. Okay, few items which you can add to your diet. If we quickly list them out, you must have read about a lot. There are some papers also on them, so you can add fenugreeks to your diet, you can add moringa powder to your diet, you can add all kinds of gourds, bottle gourd, ridge gourd to your diets. Okay, you can add oats to your diet. Nuts and seeds again are very good. Then seasonal fruits are very important. Then garlic is also one thing, which has been seen to make difference. Okay. So all these things, coconut water, papaya, so all these are few things, which you can always add to your diet, which have been seen that, over the period of time, if the mother consumes it and the baby is feeding well and the mother is pumping also, then it does helps in increasing the milk supply. Okay. So yes, you can add them, but yeah, make sure that you are hydrated, you are well hydrated, and you are frequently pumping. Let us suppose if a mother is not latching, then it is very important she should pump every 2 hours. Okay. And if you are latching and you still feel that the milk supply is less, then add pumping sessions. Just add pumping sessions after every feed. So that is really going to help you to increase your milk supply.
Wow. I think that's a lot of useful information for all of us.
Absolutely.
Definitely, that's very helpful. Uh, in the interest of time, moving on to the third section, which I also want to discuss with you today is about weaning off breastfeeding, which is something which I'm also personally very interested to know about. So I'm currently feeding my child, also night feeding him, and he wakes up multiple times during the night, to continue to breastfeed. And like me, there are many mothers out there who maybe are wanting to wean off, but they are not sure what to do. So how can we do it gently? Is my question.
Yeah. So, the very first thing is that it is really important for a mother to understand that, what are the reasons because of which, the mother wants to wean. Because there are few myths regarding weaning which we really need to clear out, okay? Like if you are weaning that, because the baby will start eating better, that is not going to happen. Because this is always, many of the times it is said, that the baby is feeding, breastfeeding throughout the night. That's why the baby is not eating the breakfast properly. It is just a myth, trust me, because that is not related to any kind of, that the baby will breastfeed throughout the night and the baby is full. That's why the baby is not eating. That is just a myth. Secondly, if you think that if you are not going to feed the baby is going to sleep better. Again, that is not going to happen because breastfeeding is something which is a kind of pacification for your baby. Like we all have to understand that sleeping throughout the night is a milestone or a skill which babies learns over the period of time. Okay, so there is no baby, who might sleep for 6 hours or 8 hours at a stretch, like adults. Even adults get up. Trust me, whenever you are sleeping at night, in the middle of the night, you will just get up to turn on one side or maybe to use the washroom. Okay, so we have to understand that this is not going to happen. So let us suppose, if you want to start weaning, okay, your baby because of any reason. So first advice is just try to not do it before 2 years of age or 18 months of age, because before that it would be really difficult for you, because babies are not in that developmental position to accept that change. Okay, but
Mhm.
still we will discuss few methods, I'll list down few methods which can help you. It is always important to go by gentle weaning methods. Don't use any kind of things to apply on your nipple, because that is really going to create negative association, with the baby. Secondly, don't do such things that, you are just disappearing from the house so that the baby won't ask for milk. It does happen, if the mom is working, let us suppose, for the working moms, if you want to wean, so once you will go out of the home, that is going to happen, within 5 or 6 days. Baby generally get used to it, when the mothers are not around, they get used to it and they start taking other things, they start eating other things. Okay, but if you are at home and you want to start it, it is always better to start by weaning off afternoon feeds, okay, and
Okay.
then move towards the night feeds. Okay, now the afternoon feeds also, just try to, wean one feed at a time. Okay, so don't be in a rush. Okay, like I have to do it in 5 days, 10 days. Just give some time, give a period of 1.5 months. Okay, so that the gentle weaning happens. Now once you have to wean, you can try a few things. Is like, try to talk to your baby about how, now, the milk, the mama's milk is going on vacation, or whatever your child calls it, doo boo boo, whatever your child, tells about, talks about it, just try to convey it to the baby. First start talking that what next is going to happen, because something which happens very suddenly affects the mind of the baby a lot. Okay, it happens with adults also. Try to help them understand the difference between the day and night. So you can tell them, Mama is going to feed you at night, not in the daytime. Okay, so when there is light, no feeding. When the light will go away, then we can feed. Okay, this is how you can gradually start, and trust me, they understand. The third thing is, spot weaning. You can just decide one spot at your home and just make sure you feed there only. So in such cases, if you go out somewhere and, if you are in other part of the house, you can always tell baby that once we'll go in the room, we'll sit on that couch, then only I'm going to feed you. So there's a kind of association inside the baby's mind. Okay? The last thing is, try to reduce the duration of feeds instead of just straight away stopping them. Let us suppose you are feeding for 20 minutes. Okay, so you can bring it down to 10 minutes. You can start putting alarms. Okay, put an alarm. Tell it to your baby. As soon as it will ring, we will stop feeding and then we will start playing. Okay. The next thing is, try to engage your baby, in different activities during the times when you know the baby is going to ask for feeds. Okay, you can always take them for a stroll, or you can engage them in some kind of activities. Okay, these are the times. The last thing I would say is, try to offer some replacement. So like, try to offer, if the child is above, obviously, you can offer favorite snacks, few sips of water. Okay. During the daytime, you can obviously offer milk, if the child has started with cow's milk, or any kind of drink you can offer. Okay. And make sure there is no sugar in that. Okay? And, I would recommend during the night hours, because, milk during night can result in a lot of dental issues also. But during the daytime, you can follow this. Okay. And the last thing is, I have seen that babies need breastfeeding to pacify themselves to go to sleep, right?
Yes.
It is really important to set a nice sleeping routine. Okay. Like, let us suppose earlier breastfeeding is a kind of method which is helping you. So you need to find out other methods which can help your child sleep. That can be reading books, okay, talking to each other, listening to some music, very slow music, okay, going on a walk and then playing and then coming back and then sleeping, okay, then taking a bath and massaging. Okay, and at times you can offer some bedtime snacks also. Okay, like if the baby wants to sleep. So these are the things which you can follow during the afternoon. You can take help from your family members also. Like you can be around, but give them in charge to make baby sleep. Okay, give them that authority, and they can feed the baby. Okay, and once you achieve the afternoon feed, just wait for a few days and then start by weaning of night feed. Because you will see once you will start weaning of afternoon feeds, your baby will want more feeds during the night time because the baby is, missing upon that attention which the baby was getting throughout the day. Right. So that is going to increase. So don't worry about that. Continue with that. But then once you are able to achieve it, then after 15 days or so, you start by night. Try to, wean off the feed just before sleep at the end. Start by the feed which are throughout the night. Start weaning them off first one by one. Okay. And trust me, there would be days, when your baby might cry, for the milk. Okay. So your partner can play a great role by holding the baby, by rocking the baby, talking to the baby, So they will cry, but, you know, in that case, always, if the baby is crying a lot, you can always offer, but don't let that association happen that baby is sleeping with the breast on. Okay. You can always offer for 1 minute and then you can just unlatch the baby or start talking with the baby. Okay. But gradually you will keep on trying all these things. One by one, you will see that one by one the feed will start going off. Okay. So it is always preferable that you should follow over the period of time. These are just some pointers because it's a huge topic. We cannot discuss a lot, but these are few tips which are really going to help you. But if you are facing a lot of issues, I would suggest you to get in touch with a professional, so that they can set a schedule for you. What can more things can be done because every child and mother diet is different. So that's why I think these things are really going to help everyone.
Yeah, I'm definitely going to try some of it for myself for night feeds. Dr. Prachi, thank you so much for that. Since we have last few minutes left, we have tons of questions from the audience, but they're not related to this topic, so we will restrain from asking those questions. Uh, Somebody has also asked about using nipple shield. That is something they're asking, can we use it to, when you have pain or you have sore nipples, can you use that to breastfeed your child?
Okay, so yeah, nipple feed is a lactation aid, which is very famous these days, and generally I've seen that a lot of doctors also, and that's the first thing which has been advised to the mothers. So trust me, it also creates a kind of barrier between the nipple and the baby. But yes, let us suppose you are having a lot of sore nipples. I would definitely suggest you to first consult professional, okay? Because sometimes it is just a minor latch issue or a position issue. And once it is corrected, even if the nipples are sore, once the position and the latch is corrected, the mother doesn't feel any pain while feeding. Okay, it might be during the starting and during the end, but while feeding, there is no pain at all if the latch is correct. Okay. But let us suppose it is very sore and you've been already suggested nipple shield and you are using it, it's okay. Continue to use it till the time, the nipples are sore and also get your latch set. Okay. But make sure you are not using it for a very long period of time. Okay. Once the nipple heals, try to start weaning it off. Otherwise, if the baby starts, gets used to nipple shield, it is very difficult to wean it off. And it also does affect your milk production because the baby is not directing latching on your nipple.
Right.
There is a barrier in between. But yes, I won't deny to the fact uh, that there are few mothers who does use them and it helps. Okay, but
Okay.
as per your recommendation, it is not recommended. It is suggested that we should not use them. But if it is helpful, it is helping you. Make sure take help from a professional so that it can be weaned off at the right time.
Okay. Makes sense, actually. That makes a lot of sense, Dr. Prachi. One last question for today we have is around using pacifiers. Can we be using pacifiers to wean off feeding gently, or is that something that's recommended? Because a lot of people are talking about pacifiers these days. New mothers want to be using that. which was not the trend earlier in our country.
Yeah. So, I have seen, a lot of posts on it also, a lot of reels that initially, you can use pacifier. Don't like you can use pacifiers once once the baby is good with latching and feeding, then you can start using pacifiers. It will not cause any harm. But if you will do a detailed study, if you will do a detailed research, it has been, it has been seen that pacifiers does create a lot of confusions in baby's mind and. I am not a big fan of recommending it. There are few doctors, few professionals who might recommend it, but I personally would think that the mother's chest, the mother and the fathers, biologically they have been designed to pacify their babies. I know it can be very exhausting, I understand those sleepless nights can be very difficult for a mother as well as for a father, and we always try to find out other options. But trust me, that these are just phases. If you are able to manage it, if you're able to manage it, if you have help around, try to pacify babies on your skin, try to breastfeed the baby, okay? And while weaning also try to, because again you are creating another habit. You are already weaning off your baby from one thing and you are putting the baby into other thing, then you have to work on that also. So it is better if you are trying to weaning, try to offer, try to introduce some kind of new toy to the baby, so that a stuffed toy with which a baby gets attached, okay, and sleeps hugging it, try to offer some favorite snack of the baby, which baby takes and gets some nutrition also. Try to offer water, try to offer milk throughout the day, okay? So such, and try to talk to the baby, try to read out stories, try to spend time together, So all these things are going to help you connect with your kid, okay? So I would not suggest, but then I completely, I always say that I respect everyone's choices. So if you decide something for your baby, just read about pros and cons of it and make an informed decision. And if you have made one, then don't be guilty about it. It's okay, whatever you decide is best for your baby, right? And for as per your circumstances also. So yes, this is my advice, but just go forward, if you think that, things won't work without it, it's okay. No, no, no offense, okay? It's okay.
Yeah, no, I think I totally resonate with what you're saying. Every mother, it works differently for every mother depending on the circumstances they are in and what they choose to do. Mothers know what's best for their child. So yes,
Absolutely.
that's perfectly fine. For me personally, also pacifier hasn't worked. I tried once, but it didn't work, and I didn't think it was required, so I've
Yeah.
not been using it. But of course, if there are mothers who are using it and it's working for them, then
Yeah.
we totally respect that.
And also, if it's working for them, one last thing that if you're using it, just make sure that you wean it off, at the right time. Okay. I think you should not use it for a long period of time because, being a dentist, I can suggest you that such things can really affect, the oral structure of your baby, the way in which the teeth are going to erupt. So make sure, you just read about it, that how it can have negative effect also. So very important to know about all these things, That's right.
So yeah, I think that's all we had, and we are about time.
Yeah.
Any last thoughts or any message you have for everyone who's joined us today?
First of all, I would like to thank you, Pooja, that I am really happy because, I'm like really passionate about talking about breastfeeding, and because I can talk for hours about it, and because I really want that, mothers are in so much of confusion, their doubts should be solved, and such opportunities really help us, reaching out to more people. Secondly, for all the breastfeeding moms out there, uh, or the breast pumping moms or the formula feeding moms, to all of you, you all are doing great job. So just be happy about it, that you are raising a baby. If you are facing any issues, please don't stop yourself from getting any help. Don't get influenced by the people around, because that is really going to create a lot of problems for you. So seeking help from a professional, is very, very important. So do take out that time and do seek that help from everybody. And if we were not able to answer any of the questions, you can always reach out to Pooja. You can send questions to her, or maybe once we'll be posting it, you can mention in the comment section, or you can reach out to me. We would love to clear all the doubts. Thank you so much.
Thank you, doctor, so much for everything, all the information you've shared with us. I think it's really going to be helpful for so many mothers out there, which is also the motive for these live series, which I've started, with experts and professionals like you.
Absolutely.
Want all the mothers to be able to access all the authentic information from the experts themselves, because there's so much information available on the web. It's very
True,
easy to get confused with so much information,
true,
right? So thank you so
true.
much. We look forward to doing many more sessions on various topics. And
Right.
yes, for everyone else, we will be posting it shortly and we'll share the link with all of you. Thank you so much.
Welcome. Okay. Bye
Bye.
bye. Take care. Have a nice
Bye.
evening. Bye bye, Pooja. Thanks.
Bye, Prachi.